Very pleasant morning to one and all present here. It gives me immense pleasure and privilege to be the part of the generic talk series on Engineering a Healthier Heart, Preventive Cardiology for Future Innovators. A genuine leader is not a searcher for consensus, but a molder of consensus. The very essence of leadership is that you have a vision. You can't blow an uncertain trumpet, leader. Now I call upon such a leadership, Dr. K.K. Tyagarajan, Professor and Dean Research, R.M.D. Engineering College, to address the gathering. Over to you, sir.
Good morning to everyone. Greetings from R.M.D. Engineering College. I am delighted to welcome you all to the 11th talk in this generic talk series of R.M.D. Engineering College. First and foremost, I would like to express my heartfelt gratitude to the management of RMK Group of Institutions and our beloved principal for their unwavering support in organizing these insightful sessions. Without their guidance and encouragement, events like this would not be possible. Today, we are honored to host a very special talk titled Engineering a Healthier Heart, Preventive Cardiology for Future Innovators by none other than Dr. S. Balamurugan, an esteemed interventional cardiologist from Christian Medical College, Vellore. On behalf of the management, principal, HODs, faculty members, students, and on my own behalf, I am very glad to welcome Dr. Balamurugan. Welcome, sir. We are privileged to have Dr. Balamurugan with us, and I am certain that his expertise in preventive cardiology will inspire and enlighten us, especially the aspiring engineers who are always looking out for innovative solutions in healthcare. I would like to express my gratitude and extend a warm welcome to the head of the Department of ECE Department, Dr. Kalan Prabha, Dr. Chilambu Chelvan, Controller of Examinations, Mr. Jagan Babu, and Mrs. Anida, the coordinators who have been the backbone of arranging this wonderful talk. I also extend a warm welcome to the heads of the departments, faculty members, and our dear students whose participation and enthusiasm truly enrich every event. This session, scheduled for 6th October 2024, Sunday at 11 a.m. via the RMDEC YouTube channel, promises to be both insightful and engaging as we explore the interaction of the engineering and cardiology. I urge all HODs, faculty members, and students to actively participate in this talk. I look forward to a fruitful and inspiring session. Welcome you all once again for being here today. Welcome all of you.
Thank you, sir. The function of education is to teach one to think intensively and to think critically. This is the goal of a true education. Now I request Dr. A. Chilambu Chelvan, Professor, EC Department, R.M.D. Engineering College, and also Controller of Examination of R.M.D. Engineering College, to introduce the chief guest of today's generic talk series. Over to you, sir.
Thank you, sir. Good morning to all. It gives me an immense pleasure to introduce the distinguished speaker, Dr. S. Balamurugan, Interventional Cardiologist, Christian Medical College, Vellore. He is currently working as Assistant Professor, Department of Cardiology, Christian Medical College, Vellore. He completed the MBBS program at Stanley Medical College from August 2009 to March 2015 and Doctor of Medicine at Teal Park Medical College, Chennai from May 2016 to May 2019. He obtained Doctorate of Medicine at Christian Medical College, Vellore from December 2020 to December 2023. Our speaker secured the state first rank in the higher secondary examinations in 2009 scoring 1,184 marks out of 1,200. During the MBBS program, he was awarded the Going Path Memorial Gold Medal in Community Medicine at Stanley Medical College, Certificate of Merit for Proficiency in ENT conducted by the Department of ENT, Stanley Medical College. Dr. C. Senthilnathan's Gold Medal for Proficiency in Clinical Medicine conducted by the Department of Medicine, Stanley Medical College. Dr. K. Vasudeva Prize for Proficiency in Chest Diseases. Dr. P. Arnachalam Gold Medal for securing highest marks in Community Medicines by MGR University and secured first in Diabetology quiz conducted on World Diabetes Day 2013 in the state. He was also awarded Dr. George M. Cherian Gold Medal in DM Cardiology. He presented a poster on case series of post-transplant infections in renal transplant recipients at the Topicon 2017 conference and a poster on adult onset Kawasaki disease at the Abicon 2018 conference. He also presented a case report of cardiac disease at ECHO India 2022. The speaker published a research paper on diastolic dysfunctions in arthritis in IOSR Journal of Dental and Medical Sciences, October 2018, and miliary tuberculosis in University Journal of Medicine and Medical Specialties. He is currently pursuing research in the following areas: HPR ACS study, retrospective high bleeding risk in acute coronary syndrome, clinical profile of ACS in young females, angiographic profile of coronary ectasia in Indian populations, outcomes of plain balloon angioplasty versus drug-eluting balloon angioplasty. So, safety and efficacy of thrombosuctions in coronary arteries. So, we are delighted to have Dr. S. Balakumaran as a speaker of today's event and look forward his valuable insights on engineering a healthier heart, preventive cardiology for future innovators. Once again, I extend our warm welcome to the esteemed speaker. Welcome, sir.
Thank you, sir. What is stronger than the human heart, which shatters over and over, still lives? Your commitment to response deeply, and we are eager to hear you. We are grateful for your presence, which underscores the importance for your gathering today. A good doctor treats the disease, a great doctor treats the patient who has a disease, said by the William Osler. Here today, we have such an eminent person to guide us to take good care of our heart today, not for a better tomorrow. Over to you, sir.
Thank you for such a great and detailed introduction, sir. I'm really humbled and honored to be here among all of you. With that, I think I can share my screen and move on to my talk. Jagan sir, is my screen visible?
Yes, sir.
So, we shall move on to today's session, engineering a healthier heart. Why this talk on a Sunday noon when you have all the things in the world to do? Why this talk, especially to a very younger population, say less than 30 years old? Why should we talk on prevention of heart diseases? Is it required? Is the first question. You may be wondering, is that so common among younger population, heart diseases? Are we supposed to do something to prevent those diseases? So I hope at the end of my talk, you will realize that this is of paramount importance in the present day. Do you know what is the most common cause of death worldwide? It is not a road traffic accident, it is not lung cancer, it is the cardiovascular disease. It accounts for 32% of overall death worldwide. And this is the data from Global Disease Burden Registry in 2017. So what it essentially means, it means that 3 out of 10 of us die because of heart diseases. Sorry for that interruption once again. 3 out of 10 of us die because of heart diseases. And amongst them, 1 in 10 heart attacks occur in patients younger than 45 years of age. And this number, between 2000 to 2016, the heart attack rates have increased by 2% every year, especially in this age group, less than 45 years. This is the United States data, which came out in circulation 2024. So on an average, someone in the US dies every 34 seconds because of heart diseases, and dies of a stroke every 3 minutes in the US. So this is happening in the United States, where they have unhealthy lifestyle, they have a lot of ill social habits. And why should I bother? In fact, we should be bothering more than them, because this is the situation in India. It matters to us. Okay, this on the left side of the image, where you see almost 4 people die out of heart attack every minute in India. And under the 30 years of age, 900 people die in India every day. Okay, this fact sheet was presented in 2023 by the Central Ministry of Health Affairs. So 40% of young people in India have heart attack, have a history of tobacco consumption. According to Indian Heart Association, 50% of all our heart attacks occur in India are less than 50 years of age, and 1/4 of all of them are under 40 years of age. So now that it gets interesting to know all these facts, I'll be talking on the various causes of heart diseases, how heart can be affected by various diseases, what are the risk factors in it, and how can we prevent all those risk factors. So this, as you can see, heart has 4 chambers. The 2 chambers on the top are called atria, and the 2 chambers on the bottom are called ventricles. Okay, and you have 2 big tubes which are coming out of the heart. One is going to the lungs, which is called pulmonary artery. The other is going to the whole body, which is called aorta. And you have 4 valves inside. Okay, this is the normal anatomy of a heart. So heart can be affected in, diseases can affect all parts of the heart. The most important is the disease that affects the blood flow to the heart. The fat get deposited in the blood vessels that supply heart. That's called coronary artery disease. The second one is the muscles of the heart which get affected and dilated, becoming unable to pump the required amount of blood to the whole body. That's called heart failure. Then the third thing, which is called pericardium, which is the covering of the heart, which gets inflamed. It's called pericarditis. This image, where the heart muscle gets thickened or thinned out. This thickening or thinning of the heart muscle is called cardiomyopathy. And this image, where you can see the electrical circuit within the heart. This starts the heart. In fact, this is responsible for the heart beating at 60 to 100 beats per minute, every minute. So any disorder in this electrical circuit is called arrhythmia. And any disorder of the blood vessels, okay, where you can see dilated blood vessels, it's called aneurysm. Any diseases that affect the valves are called valvular heart disease. And our interest is specifically on this coronary artery disease for today. Why? Because it accounts for 50% of all of the heart diseases and deaths due to cardiovascular diseases. So what is this coronary artery disease or coronary atherosclerosis? Normally, this is the normal artery, and this is the abnormal fat deposits that begins inside the blood vessels. So over time, this fat deposits, we call it as plaque, build over a period of time, not just in a day, within the arterial walls. The artery gets narrowed down, This process is called atherosclerosis, and when this occurs within the coronary arteries, the heart do not get enough blood that is required for it. Okay, this condition is called coronary artery disease. In layman's term, if the blockage becomes 100% and it occludes the blood flow to the heart, we call it as a heart attack. So whatever was taught to us was the fat deposition occurs at old age. It's actually a myth. What actually happens is the fat deposition starts from the first decade of life. As you can see, it starts as early as 2 years of age. And from the fourth decade, you have this fibrous plaque which causes heart diseases, and then the rupture of the plaque happens, 100% occlusion happens, and patient develops acute heart attack. Now that we have seen various heart diseases and how heart can be affected by diseases, we should be knowing about the risk factors for all those diseases. And before that, I'll talk about the sudden cardiac death versus heart attack. Are they both synonymous? Are they both same? Definitely no. See, you would have heard in the news saying a young healthy male walking in the park suddenly drops down dead. So he had a massive heart attack. Recently, a lot of news recently, a young girl, 21 years old, working out in her gym, running on a treadmill, suddenly dropped down dead. This is not heart attack. This is called sudden cardiac death. By definition, what does that mean? It means any stoppage of heart, okay, cessation of cardiac activity within 1 hour of symptom onset. We call it as sudden cardiac death. So it is different from heart attack, which occurs due to blockage of blood flow to the heart. So sudden cardiac death has lots of causes, and the most important cause, almost 70%, is because of heart attacks, and 30% it can be because of structural heart disease, it can be because of electrical problem within the heart, or it can be even non-cardiac causes. So you should be understanding that these two terms are different, and the causes, sudden cardiac death has other causes other than massive heart attack. So this is also very interesting to know also, stress cardiomyopathy. Okay, you would have seen in movies where the hero's mother hears some bad news, shocking news, suddenly collapses down to floor. So it's not just a melodrama, it's actually a disease. It's called stress cardiomyopathy or broken heart syndrome. It actually has a scientific basis behind it. So the most common causes are any unexpected loss of a close friend, relative, or a pet, any financial loss, intense fear, excessive physical exertion, mental exertion, sudden drop in blood pressure. All of these can cause a broken heart syndrome. So now we have seen the variety of cardiac diseases. We should be knowing what causes all of them, and are there any ways to prevent them? Yes. Am I at risk is the first question. These are the 10 key risk factors for the heart diseases. This is a general overall blanket risk factor. I'll be talking about each of them. Okay, genetics, age is the most important factor. Smoking, high blood pressure, diabetes, lack of exercise, diet, lack of sleep, high cholesterol, obesity, all these can cause heart diseases. So we divide these risk factors into modifiable risk factors and non-modifiable risk factors. What are they? Non-modifiable meaning you can't change them. Those on the left side, age, gender, genetic factors, race and ethnicity, these can never be changed. But whereas on the right side, which is highlighted in green, these are modifiable risk factors. You can change them, you can modify them, you can reduce the disease burden by acting on it. High blood pressure, smoking, diabetes, physical inactivity, obesity, and high cholesterol. All these are classified as modifiable risk factors. Ethnicity. Am I at risk? Yes, if you are from any of this region, this is called Southeast Asian region, okay, you are at risk. Yes, this Southeast Asian region accounts for 25% of the entire world population, but they account for 60% of the entire world's cardiovascular burden. Okay, why so? Why is that? We'll see that also. They have higher CVD risk. CVD matlab cardiovascular disease. They get all heart diseases a decade earlier than their counterparts in the West. And what they have is a bad diffuse disease, and they also have a high insulin resistance. This phenotype, it's called thin fat Indian phenotype, a very catchy phrase. On the left side of the screen, where you can see two people sitting, they both are obesity experts. They both are actually doctors. One is working in London as professor of endocrinology. The second on the right side, thin guy who sits, he's working as a professor in Mumbai. Okay, so this is just a comparison. On just looking at both of them, you think the guy on the right side is thin, healthy. But actually, the lateral, the extreme left and right, where you can see DEXA images. DEXA images is, we do it for assessing the body fat. So which shows that this thin guy has a body fat of 21.2%, and the left person has only a body fat percentage of 9.1%. Though their BMI is almost the same, 22.3, they have this abnormal fat body distribution. So that's the thin fat Indian phenotype we call. So all Asian Indians, they have a higher body fat, they have a higher visceral fat and waist circumference. Their skeletal mass is low, they have higher rates of insulin resistance, higher levels of CRP, which signifies inflammation, and lower adiponectin levels. Gender. These are all non-modifiable risk factors. The ethnicity that we saw, Southeast Asian, the phenotype of fat deposition within our phenotype, thin fat Indians, and the gender. These cardiovascular diseases strike men more than women. In fact, men are more likely to suffer a heart attack than a woman, and they get heart diseases 10 years younger than women. So there's no gender inequality here. There's no gender equality here, sorry. So having learned all this various heart diseases and the risk factors for heart diseases, which are modifiable, which are non-modifiable, we'll move on to things that we can change, the modifiable risk factors. So what are they? Behavioral risk factors, dietary risk factors, smoking, physical inactivity, alcohol and drug use. The metabolic risk factors, which obviously is a high blood pressure, body mass index, cholesterol levels, blood sugar levels, and the kidney function. So as you can see, the blue one is accounting for the cardiovascular diseases. So on the right side of the image, where you can see various diseases represented in very different colors and the percentage of deaths. Dietary risks account for more than 15% of cardiovascular diseases, and high blood pressure, they also account more than 10% of cardiovascular diseases. Okay, so we'll see how can we prevent them, prevent heart diseases, in fact, by modifying them. Smoking. How smoking affects your heart? It reduces the oxygen levels in your heart, it raises the blood pressure, increases the heart rate, increases the risk of blood clot formation. So smokers lose at least 1 decade of life expectancy compared with never smokers. And the smoking itself doubles the incidence of coronary artery disease, and it in fact increases the coronary deaths by more than 50%. And you should know it is the leading cause of preventable death. What happens if I quit smoking right now? Within 20 minutes, your heart rate and blood pressure goes down to normal. Within 2 years, the coronary event risk, say acute heart attack, reduces by 50%. And by 5 years, the risk approaches that of non-smokers. So the magnitude of benefit that you get exceeds all our alternative secondary prevention efforts. So if a patient has had a heart attack and then we are modifying risk factors with drugs, say for example cholesterol lowering drugs, that benefit will be lesser than smoking cessation. So that's what it essentially means. But unfortunately, the risk of cancer persists even beyond 10 years of age. So, whenever we see patients in OPD, so I say you should stop smoking, and then the relative comes up with a question, sir, what happens if I stay near that person who's smoking? So that's called second-hand smoking or passive smoking. So it's nothing, it's essentially the same, except you are not smoking. That's the only difference. All the health effects that smoker can get, the second-hand smoking can also cause. It can cause stroke, it can cause lung cancer, it can cause coronary artery disease, and when pregnant women are exposed to passive smoking, it can cause low birth weight in the fetus. And in children, it can cause sudden infant death syndrome, lower respiratory illness, middle ear disease, and whatnot. So I was shocked to see this article, which was published in 2015 in Times of India. So almost it says that 40% of Indians are exposed to second-hand smoking at home, and 32% of Indian males are exposed to second-hand smoke at work. And the tobacco consumption, this was in 2015 data, I don't have the present data, 35% of adults in India consume tobacco in some form. So whenever I ask my patients in OPD, do you smoke? They say, no sir, definitely no, never. Okay, but कुछ खाई नहीं खाते हैं सर, और सिगरेट नहीं पीते हैं सर, खाई नहीं खाते हैं, और गुटखा खाते हैं. किसी भी फॉर्म में, whatever the form is, tobacco intake is harmful. Either you smoke it, you eat it, whatever it is harmful. The second evil of the society, alcohol. Okay, unfortunately, all our guidelines are from the West. So, where alcohol is an essential part of life. So, they recommend safe intake of alcohol, which amounts to 1000 grams of pure alcohol per week, which is essentially 8 to 14 grams per drink. The limit is same for both men and women. But this came up in 2023. No amount of alcohol is safe for drinking. The risk starts from the first drop. This was the statement
I suppose there is some technical glitch. Shortly, sir will join. Welcome, sir.
Extremely sorry for the interruption. Is it visible now?
Yes, sir.
Yes, sir.
Sorry, extremely sorry. So, sitting is the new smoking. So, what does it mean? It's a catchy phrase that we use. The longer you sit, the shorter you live. It essentially means that you will have to be active. So, what does mean? What do you mean by being active? So, it means physically active at least 5 days a week. So, what are the benefits of being physically active? It reduces your blood pressure, reduces your arterial inflammation, reduces your cardiovascular traditional risk factors, decreases the endothelial dysfunction, reduces the arterial stiffness, thereby reduces the chances of hypertension and increases the cardiorespiratory capacity. So, how much should I exert? Is the first question. For a healthy heart, set yourself a weekly goal. So, aim for at least 150 minutes of moderate intensity physical activity or at least 75 minutes of vigorous intensity physical activity. This guy talks some Greek and Latin. What is it? What does moderate intensity mean? What does vigorous intensity mean? See, if moderate intensity essentially means if you are working out, if your breathing is faster and you're able to complete sentences, it means it's moderate physical exertion. Examples include cycling, say, walking, brisk walking, swimming, and then Zumba. All these come under moderate physical activity. Vigorous intensity is where you will not be able to complete a sentence when you're doing that. So, HIIT training, aerobic exercises, all those come under vigorous intensity physical activity. So, what if you can't do that? 150 minutes per week. So, I don't have time. I am tight on this. Start even with just 5 minutes. It all adds up. Okay. In fact, you can add muscle strength training. Do that activities that make your muscles work harder than usual. At least 2 days a week. The gym training that we talk. So, now that we have seen smoking, alcohol, and the physical activity, the next most important topic everybody wants to know, everybody have doubts, so much of doubts in this, but nobody follows it. That's the truth. Okay, so for most of my patients, when they come to my OPD, they ask how much oil should I use. For them, healthy diet is only reduction in oil. It's not so. So this is the Mediterranean diet that we suggest. So taking lots of fruits and vegetables, nuts at least 3 times per day, fish and poultry for lean meat, and taking less of red meat, less of white rice, less of potatoes, and with alcohol in moderation is what is suggested. So fat. So choosing fat, coming back to my patient's question. So what oil should I use is their first question. How much should I use? Ideally, our recommendations suggest using extra virgin olive oil is healthier and safer. Nothing like that. And first thing, the cost. See, 1 liter of extra virgin olive oil costs you $1,300. And the taste. So you cook anything with extra virgin olive oil, it is not palatable at all. So practically, it is definitely not possible to use extra virgin olive oil for all your cookings. So what we suggest is using traditional oils. Say for example, in Bihar, they use mustard oil. Kerala, they use coconut oil. So in northern India, they use this sesame oil. So what we use is gingerly oil. All these are equally good when used in moderation. So it is not the type of oil that matters, it is the amount of oil that matters. So ideally it is 3 teaspoons per day per person. So it means 500 ml of oil per person per month. That's what we advise. Okay. So fat choices, no trans fat at all, and less of saturated fat and more of unsaturated fat. So in fact, this trans fat, even a small amount, say for example 2%, increases your coronary risk by 25%. Saturated fat, ideally saturated fat has to be less than 10% of all your food intake, energy intake. So what does saturated fat means? Coconut oil, curd, red meat, butter, all these should be less than 10% of your entire food intake. And unsaturated fat is better, you have to eat more. For example, omega-3 fatty acids, which are rich in fish, flax seeds, and mono unsaturated fatty acids, which are rich in canola oil, avocados, and omega-6, which is abundantly found in vegetable oils. Salt and heart. So this picture I took from the internet, which depicts beautifully salt and a BP apparatus. So ideally, average Indian diet, it contains approximately 15 grams of salt. So the diet that we would, I'm not talking about the added salt, the generally that we use, the salt that we use for our cooking, it contains approximately 15 grams of salt. So the optimal would be less than 5 grams per day. And what we find is even a small reduction in salt intake. Say, for example, you take 15 grams and that you bring it down to 12 grams or 11 grams or even 14 grams. That causes 6 millimeters of blood pressure reduction in hypertension patients and 2 millimeters of blood pressure reduction in normal patients. So this is from American Heart Association, the salty 6. Breads and rolls, pizza, sandwiches, cold cut meats, soup, and burritos. All these are rich in sodium. So ideally, they should be avoided. So the daily suggested reference is less than 2.5 grams. That's practically impossible, but at least less than 5 grams is acceptable. So whenever you go to a grocery store, always remember to check on the label to look at the ingredients. Okay, how much of sugar it has, how much of salt it has, how much of saturated fat, how much of unsaturated fat. It all helps. Fiber. Ideally, in a healthy diet, fiber should be at least 30 to 45 grams per day, preferably from the whole grains and from fiber rich fruits and vegetables. So it should be both soluble and insoluble fibers. So 7 grams per day of fiber intake reduces the CV disease by 9%, and 10 grams per day lowers your stroke risk by 16%. So on the left you have all these fiber rich fruits, say avocados, guavas, all berries, for example raspberry, blackberry, pomegranate, kiwi, pears, oranges. All these are fiber rich fruits. Ideally you should take 2 to 3 servings per day, approximately 200 grams per day. And on the right side are fiber rich vegetables, which are cauliflower, carrot, eggplant, beans, cabbage, chickpeas. All these are fiber rich vegetables. In fact, they should form at least 30 to 40% of your daily meal. So the ideal food plate. So this is from Harvard University. So this is a 9-inch plate. What you can see on the left side is the green one is vegetables and the red one is fruits. Eat plenty of all colored fruits and vegetables. This should form at least 40 to 60% of your plate every day. And on the right side is you see whole grains. So you'll have to eat variety of whole grains. Say for example brown rice, okay, instead of white rice, white bread. Okay, so eat I don't know, even the internet doesn't want us to eat healthy foods. So, continuing the diet part of my talk, so you can always swap. Sir, am I audible, sir?
Yes, sir.
Yes, sir.
Sorry. So the ideal food plate we were talking about. So you should limit your red meat intake to less than 300 grams per week. So, and regarding dairy products, you should limit milk and dairy to 1 to 2 servings per day, and avoid sugary juices. Drink lot of water, ideally 3 liters per day. Regarding tea and coffee, all my patients invariably ask, how can I take tea and coffee? So 3 to 4 cups per day is advisable. It's not harmful. But when you take more than 10 cups per day, it is harmful. And healthy oils. In fact, you can start using oils in cycles. Whatever oil you use, you can change it to the other oil the next month, and the next month one more oil. So all oils are equally harmful to say. So it is the amount that matters, not the type of oil. And eat plenty of fruits and vegetables. We already saw that. So when you can have so much of food, the niche wala bread with fruits and chicken and quinoa for a 930 calories, why take burger and French fries for the same calories? So let's do this healthy snack swap for a healthy heart. So instead of ice cream, you can take a chia pudding. Instead of pizza, you can take a deli wrap. Instead of cookies, berries. Instead of candies, frozen grapes. Instead of chips, you can take air popcorn. Instead of fat cheese, you can take green yogurt. All this helps. So now that the bigger part is over, we'll move on to the other factors that can be modified to reduce or prevent your heart diseases. Sleep. This is in fact added a new addition to our American Heart Association recommendation. Until 2020, it was a healthy 7 for a healthy heart, and then they came up with life's essential need. They have added sleep to it. So, sleep is vital for cardiovascular health. The benefits include improved mood, improved memory, and reasoning. So, ideal recommendation is at least 7 to 9 hours per day for people less than 60 years. More than 60 years, as you age, naturally your sleep hours get reduced. So, babies and kids, they need more sleep depending on the age. Too much or too little can be harmful. So, what are the daily habits that can we do to improve sleep quality? You can be physically active throughout the day. Do not take an afternoon nap. Establish a constant bedtime routine. Avoid hitting the snooze button in the mornings, and keep your electronics out of the bedroom. That's the most important habit that will help to improve your sleep quality. The cholesterol. So cholesterol role is essential for a healthy body. We talk about cholesterol is bad, cholesterol is not good. So do I strive for a zero bad cholesterol? If you ask me, no, definitely no, because it is essential for all your bodily functions. So excess cholesterol can lead to blocked arteries. So the health risk associated with this increased risk of stroke and heart diseases. Every one of us know. So always check your cholesterols every 4 to 6 years. The more frequent checks are required if you have a higher risk for heart diseases, or family history of heart diseases, or family history of dyslipidemia, which is abnormal cholesterol levels. So regular checkups help manage cholesterol and reduce cardiovascular risk. So understand the cholesterol. Cholesterol is a fat-like substance that comes from two sources. Your own body produces it, and it also comes from exogenous, from food. Okay. So HDL is called good cholesterol, high-density lipoprotein. It's called good. It's called protective cholesterol, and the LDL is called bad cholesterol. So I'm not going into details of the targets. That's for medical population. So what you need to know is this is good, this is bad. When should I consult a doctor? That's the motto of this talk. So nothing more than that. So importance of blood glucose monitoring. You should know your blood glucose levels for the overall health. Two common tests that we do are fasting blood glucose and HbA1c. HbA1c is 3 months average blood glucose test. So the fasting sugars have to be ideally less than 100, 75 to 100 is the range, and HbA1c should be less than 5.7. Okay. So Periodic screening helps you to identify early, treat early, and prevent complications. Blood pressure. High blood pressure puts extra strain on the heart. It has to pump against the high pressure system. So this can lead to various cardiovascular diseases. The numbers that we look at are 130 and 80. So your blood pressure should be ideally less than 130 and diastolic should be less than 80. A single reading isn't an immediate concern. Monitoring is the key. Sometimes you see a healthcare professional, you get anxious, your readings may be abnormal, but that one reading is not a concern. So normal blood pressure is ideally 120/80. So you should at least check once in 2 years if it is normal. So this was the 7 healthy tips that I was talking before. This is from American Heart Association. So you don't have to be heroic to reduce your heart attack or stroke risk. These are the 7 healthy habits that can potentially save your life. And so what are they? Eat a healthy diet, okay, and then get active, okay, control your blood sugar, watch your cholesterol, maintain a healthy weight, monitor your blood pressure, live smoke free. If you smoke, please quit. And the 7th one is adequate sleep, and the 8th one is adequate sleep. So I want to end my talk with this quote which I came across some 2 years ago. You can have 1,000 problems in life until you have health as a problem. Then it is the only one problem that you will have. So prioritize health, take steps, make little changes each day, live longer, healthier and happier. Thank you all for your patient listening and putting up with my bad internet connectivity. Thank you.
Thank you, sir. One beautiful art is better than 1,000 beautiful faces. Your genuine concern and expertise have a lasting impact. Thank you for being an outstanding doctor. Your expertise and expressional speech have made a great real difference, sir. Thank you, sir. Now I request Ms. Anita, Assistant Professor, EC Department, R.M.D. Engineering College, to deliver the vote of thanks. Over to you, ma'am.
Thank you, sir. It gives me immense pleasure to propose the vote of thanks on behalf of R.M.D. Engineering College. I would like to thank the management for giving us the opportunity to arrange the guest for the Generic Series 11. Speaking of which, we are glad that our management not only gives importance to academia, but also in all-around wellness of RMK groupians. These kind of talks in Generic Series gives us awareness on taking care of our physical and mental health, which paves way for our academic achievements. In the context of prevention is better than cure, I would like to thank Dr. Balamurugan for enlightening us of how to take care of our heart. What is this life full of care? There is no time to stand and stare. We are thankful to Dr. Balamurugan for sharing his time, the value of which is immeasurable, he being an interventional cardiologist. I would like to thank our principal, Dr. N. Anvicharian, who always chooses the best among the options, be it a guest or the courses. I would like to thank our HOD, EC Department, Dr. K. Helen Prabha, who has always been a back support to us in guiding us in all our endeavors. I would like to thank Dr. Tyagarajan sir, Dean Research, and Dr. Chilamutchelvan sir, COE, for their introductory talks. I would like to thank the viewers with whom the program is a meaningful one. Last but not the least, I would like to thank everyone who has rendered their support for making this program a grand success. The person is alive, even with the brain is dead. Take care of your heart to be a lively person. Thank you.
Thank you, ma'am.
So thank you very much, sir.
Thank you, sir.
Thank you, sir. Thank you.
Thank you, sir. Thank you so much.